to our Unclenched podcast. Today we're talking to a physical therapist. We'll be getting into that in a minute and what they do and how we utilize them in our dental practices. And at the end of the podcast, we'll answer a couple questions like we always do. But before we get started, I need to get caught up with Priya because it seems like a lot's been happening. What is up? And I want to hear about a patient too. What's going on, Priya?
Yeah. So I am hiring an associate for my practice. He is a general dentist, but what's interesting about him is he actually was in a study club with my mentor. So his
Oh,
name
well,
is Dr.
wait.
Fred.
How
Yeah.
how much older is he than you? Because your mentor's
Ooh.
rather older.
Oh,
And
am I
is
allowed
that
to
going to
say
be okay?
age? Yeah. So he's probably in his mid to late 50s, and I'm in my
Oh, well,
early
that's
40s.
good.
Yeah. So
That's young.
he's still young. Yeah, exactly. So and he's
Yeah.
great. He's very well trained in all of this. And what's cool about him, Alex, is he does phase two and I don't. So we have
So
someone
what kind of
well,
phase two does he do? Does he
so he
do
does full mouth reconstruction. He doesn't do ortho,
the
not
full
ortho.
mouth? Nice.
Yeah. And so there are some people that would really benefit from that. And I have probably a handful of them a year, and then we have to figure out how they can get that treatment. And now it's just going to be all in office. Everything's going to be very streamlined because we know the bite. We know where the patient's jaw is stable and happy, and then if we can build the teeth up to that position, it's going to be awesome. So that's what I'm excited about. And in terms of a patient, I mean, I've just been utilizing DTR so much, and every single
Yeah,
person I've utilized it on has benefited. So
I
it's
know.
amazing.
Isn't
Like,
it
yeah,
crazy?
it's crazy. And I think I just want to get the word out there more and more, not only to people that are suffering, but to dentists to, invest in learning about this and the technology that goes with it. I just think it's just such a great service to be able to offer our patients that are in pain.
Yeah, yeah, and I would love to use it more than I do, but a lot of times when I see joints, they're so
I
deteriorated,
know.
and I'm like,
I know.
"Oh, it's awful."
It's
But
not for
the thing
everyone.
about getting the word out to dentists about DTR, which is disclusion time reduction, a lot of dentists, like I spoke at a study club for dentists, and most of my talk was on DTR. And at the end of the study club, it was like crickets. I'm like, y'all have any questions? Like, I'm so excited about all this stuff. And it's hard sometimes to get people to change their ways after they've been practicing a while, but we gotta try. We gotta
We
try.
gotta just keep trying. Yeah, we
Yeah.
just gotta keep pushing. But what about you? What's new with you? Tell me about a patient of yours.
New with me, my daughter's graduating from dental school in May,
Yes, yes.
and she's moving to Denver to do a GPR, a general practice residency for dentistry. And I hope one day she comes back to be with me, but jury's out. I mean, she's got to do what she wants to do. So that's what the real excitement is going around here right now.
That is
But
really exciting.
it is. It's so exciting, and she just has to do her own thing. Like when she went to dental school, she didn't want to go where I went. She didn't want to go here in Pittsburgh because people knew me, and she's like, I just want to do this all on my own.
That's
So when
awesome.
it came to the residency, I'm like, I know blah 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 at Allegheny General. I know blah 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 at Pitt. Like, do you want to go, Mom? I'm doing it on my own. I'm gonna go to Denver. And I'm like, okay. So I don't know if she wants to do it all on her own forever, or I think she'll circle back around. But I always told her too, once she started dental school, I'm like, I don't I don't want you to come back to work with me for at least 3 years, because you need to experience it. You need to know how offices run and all that kind of stuff. And so yeah, she's doing what I told her for once. So there you go. But
I love that
yeah, I do too.
for
I do
once.
too. Yeah, yeah.
That's
But
what my parents would say about
yeah.
me for once.
So I have a patient, and this is going to kind of lead me into our guest, Josh, who's a physical therapist, and he and I treated her together. She was in for a cleaning maybe about a month ago, and she was in a lot of pain. And Josh, are you there? You remember Fallon?
I do, yes.
Yeah, yeah. So Fallon came to me. Her mom brought her to me, and I don't know. She was maybe 19 or so when she came, and now she's been good for a few years, and she's married. But when she came to me, she was 19. She stopped going to college for a while because she couldn't even like walk down the hall unassisted. She was in pain. She had brain fog. She had neck pain, wasn't sleeping well, jaw pain. And I was able to get her bite right and get her pretty good. We ended up doing orthodontics on her. So that was her phase two. But she still had some neck issues, hip issues, muscle issues, and I couldn't resolve them on my own. And that's what I always tell my patients, like, I can get you there. A lot of times we can complete and be fine, but there are times I need to pull someone else in. And with our license, we can only work from, the neck up. And then Josh looks at so many things. So then he fixed her neck, helped with other muscles strengthening and such. And now when she gets a flare up or something because something's out of whack, I'm like, you need to see Josh first, then come see me. Right,
Mhm.
Josh?
Yeah, yes, and yeah, and we usually can, help with just a visit or two, like not like what was at the beginning, but yeah, we can
Right.
normally, get her back in shape very quickly. Yeah. So
Yeah. 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 So Josh and I, we've been working together a long time.
yeah, I was
So
trying to think. It's about probably 11 years, right? 11 or maybe more than 11 years. It's been a long
yeah,
time.
yeah, it's been a long time.
Well, thanks for being on, Josh, and I've heard a lot about you, and so I wanna know, how did you guys find each other?
Yeah, so I appreciate it. Yeah, I appreciate you guys having me on, and like I'm always excited to geek out about TMJ disorders.
Yeah,
So, but yeah, the way we found each other, I think, was a mutual patient that
right.
I treated her neck. Maybe
You
was that?
did. You did. So it was Sue, and she came to me, and I think at that time I had helped her husband because he had ear issues, and we reconstructed his full mouth. And I'm like, she was talking about she just came back from seeing you, and her neck was bothering her, and this and that. And I'm like, wait a minute, you have a neck guy? I need a neck person. So then there you go. That's how I met Josh.
And I just happened to be like a mile down the road, I think, right at the time.
Yeah,
So it's
yeah, yeah,
pretty,
That's nice and
pretty.
close.
Yeah,
yeah.
it was very kismet, as they'd say. So,
Right, right.
That.
So I used to go, in fact, I used to go in the beginning, I'd go to Josh's office with my patients. Remember, Josh?
I do. Yes, I think you might have even done. Did you do a block in the office once?
I probably did an SPG block.
Yeah,
Yeah, yeah, yeah,
that was pretty wild. I mean, I knew
yeah,
even before that, like this, I had had a little bit of experience treating TMJ in my P when I had done my PT training, and then I kind of had gotten away from it, but got um, you know became a COMT and treated a lot of neck pain before that. But I remember when you started sending me patients, it was one of the early patients. Um, he was so desperate prior to seeing you, he had filed his teeth with with a file in his like toolbox because he was
Oh my
and
god.
he was a professional. This was an attorney. This was a high functioning. And then by the time after so his obviously he was desperate. And by the time I saw him, Alex, you had sent him to me. He was like
yeah,
down to like one or two pain. I just like basically like cleaned up a little bit of some of his
right.
neck pain and posture. And I was like, wow, this is awesome what we can do for
Yeah,
people, or what you
yeah,
guys could do for people through through your orthotics and the and so
yeah.
that was I was sold at that point. I'm like, I definitely want to treat these people with
That's really
Alex, and
cool.
then so
Yeah.
yeah, that was
Really cool.
awesome.
And I'm thankful.
Oh, I love that you guys are. I don't have a PT I regularly work with. I have a few upper cervical chiropractors, but not a PT. So do all PTs, physical therapists treat TMJ problems? And where did you get your training for this?
Yeah, so in in PT school, which is a doctoral level program now everywhere, you are going to get a few hours of training in TMJ, but if you know it's if you don't have experience in it, you're not going to. Most therapists don't feel comfortable with it. What I did, and a lot of therapists will go on and they'll become certified orthopedic manual therapist, which treats a lot of the neck and spinal issues. And then from there, for me, it kind of naturally moved on with having Alex sending some patients. And then I did more training with that Alex actually recommended with Dr. Mariano Roccabato, who has
Mm,
probably been treating TMJ longer than anyone on the planet. I think he's been doing it for like 60 years. Um, and I've done a lot of coursework under him, which has been awesome.
Yeah.
He was, I mean, he was great. And from there, I've just done more just self studies and some more, continuing education. But so, in other words, you probably want someone with some experience, or definitely experience with the cervical spine, to at least start, because sometimes we can, that upper cervical spine has a lot to do with the TMJ joint and the facial pain, oral facial pain. So,
Yeah. Yeah. And people don't connect that.
yeah. So yeah, I mean, when you look back at when there's a thing called the spinal trigeminal nucleus. This is getting real nerdy, but that that's a two-way street. So the trigeminal nerve, which like controls, our jaw joint, our jaw, and our facial pain, that corresponds with C1, C2, C3, and they can go back and forth. So they're kind of unique. That's that nucleus, and that like if I'm gonna if you're gonna have upper cervical pain, it can refer forward to the jaw, and the jaw can refer forward back, or can go back to the neck. So it's I think there's a lot of connection that, like you said, Alex, I think a lot of people miss and don't understand.
Mhm.
Um,
Yeah.
totally.
so I do a lot of postural things with the patients, but um, yeah, anyways.
Yeah.
Well, can you explain like how the jaw is connected to the rest of the body, specifically the neck and spine, and like which muscles are involved?
Yeah, so when you're looking at the jaw, um, yeah, I'll pull up Mr. Bones. I cracked his skull accidentally. But yeah, so when you're looking at the jaw, you have the mandible, which everybody knows. This is what everyone thinks of the jaw, and then the cranium, and that's the temporomandibular joint. And then you have the cervical spine, upper cervical spine. The muscles that connect to that we really end up addressing are what's called the suboccipital muscles, which are the muscles that go back from the skull down into the upper cervical spine. And then we have the SCM muscle, which attaches right here, right behind the skull. And that goes down to our clavicle, and then the scalenes, which are muscles that attach up to the neck, or to the upper cervical vertebrae, down into our first and second ribs. Um, there's a lot more postural muscles that are involved in that area, but the neck, those ones are the ones I see the primary culprits. That and one other one back here, which you guys wouldn't be able to see, but it's called the levator scapula, which is attached into the shoulder blade. So a lot of what I end up doing with patients, particularly with that forward head posture, which I think you probably see a lot of your patients with TMJ disorder have that forward head posture, is we really work like body work, that those muscles to get the head into better alignment so that the skull isn't getting pulled backwards. And where I find it is, and I was showing Alex this, is if you guys go to underneath your chin and you you poke around, there's like these muscles that attach to back to your throat, and there's a bone right there at the top of your throat called the hyoid bone. So we have all these, what they're called, these infrahyoid muscles that attach from the jaw to our throat. So when we swallow or move our food around, those are getting activated. They put a ton of pressure when we're in a forward head posture because they're now getting stretched. So that's some of the muscles that we do a lot of work with on people that have that forward head posture. And I think
Totally. And what would you say causes that forward head posture?
So a lot, it can be, some of it can be airway. Some people, like, they're going to do, if they have a poor airway, particularly if they have sleep apnea, they're going to go into this forward head posture because they're trying to give themselves more air. Some of it is bad posture further down the line.
Sure.
And I think if you have people that their jaw, falls back into into the back of their, so posteriorly, that can also cause that airway. So they're going to try to push forward, but it actually ends up being like a vicious circle, right? Because as you push forward, your jaw is going to get driven further back, and then we end up with that kind of a syndrome that by the time that we're seeing them, they're usually in that position.
Do you
But
think that like cell phones and tablets and stuff have anything to do with like kids getting that forward head posture? Sorry, I
Oh
know this
my.
is like not what we talked about.
Yeah, no, yeah, absolutely. In fact, like I have in my office, like I printed out an article for, like, kids are growing horns in the back of their head
right,
from
tech
the
neck.
from the
Yeah.
traction on the back of their skull, from that forward head posture. I mean, I'm sure, or I absolutely agree that, like, even our modern tech modern technology, we're all sitting, forward head posture has worsened quite a bit. So
Yeah, I think that too, but I've seen too, Josh, like when, because I take photos of my patients before, after, during, treatment and stuff like that, and I see that when they have a bad bite, and when we straighten out that bite, their head goes back. And I have pictures upon pictures to prove that. It might not go totally back, but you can
But
see a
somewhat.
difference from the middle of the shoulder. And if you draw a line up, the head's forward, then you see it coming back, and they're like, yeah, and I breathe better because they're balanced in their mouth.
Mhm.
So
yeah, I
that's
could.
what, that's what I see too. But I agree. I think just the way we are, we're on these big comfy couches, we're slouched all the time, we're not as good. Like, I can remember my grandmother's couch much, much harder than my big fluffy pillow couch. I think we're just kind of getting a little bit lazy too, and then our core muscles and all that kind of stuff. But I think bite has a lot to do with it too, plus everything else. That's why a lot of times it's not just one thing that needs to help get a patient better or in better alignment.
Yeah, it's combo of stuff.
Yeah.
Yeah, we like, one of the concepts that I use in my practice is called interregional dependence, which is that, it's kind of basically the idea that it's not, when you're treating the shoulder, let's say, it's not just the shoulder that's affected, it's also the neck, it's also the
Mm.
elbow, and the jaw can be part of that, in the same thing. We're treating both the neck and the shoulders, posture. So I think a lot of people miss that part of the boat, in treatment. So, that's
Yeah. Yeah. Well, and I know when I send patients to you to evaluate body alignment, and um with the connection of the spine, the hips, and all of that, where do you typically start? Because I know I've had you take pictures of my patients, like when they're at home at their desk, you're like, just take a picture to find the alignment, and then you help them with that. But where do you typically start? Do you start here, or do you start at the hips, or spine, or is everyone different?
so mostly I always do what's called an SFMA, which is like a whole body assessment in standing. And then there's and that I'm checking alignment. I'm checking range of motion of their spine, of their ankles, their knees, their hips. And then from there, I check their neck range of motion and jaw range of motion standing and also sitting, because I want to see what happens when if things change. And then from there, I go to lying down on their back and I check all the same things again, to see if is postures change, is their resting posture changing how they're acting. Obviously some people, if they said, wow, when I sit, I really get a lot more pain, then I would be, I'd pay more attention to sitting. And many people with desk jobs, particularly if they have a
Oh
home
yeah.
office now, we do a lot like with their home offices, right? I want to make sure that they're set up correctly there, because, everything that we do in the clinic as a physical therapist can be ruined if they, sit like this all day, for 8 hours a day.
Sure.
So,
Sure. Do you
Totally.
recommend standing desks?
oh yeah, absolutely. Yeah. Sit stand desks are great. Changing postures is probably your healthiest thing you can do. Rather than just sitting in one perfect posture, it's actually better to move around a lot. I used to be an ergonomist for Google, and
Oh, you
I remember,
did?
That's
yeah, yeah,
interesting.
yeah,
I
over
didn't
here
get
in
that.
That's
Pittsburgh. We
cool.
have a pretty big office here in Pittsburgh. Yeah. And I would walk into their office and they would see me coming and they would all of a sudden straighten up and, you know,
I know, I just did it too.
Yeah, I did too. I kind of did
and
that too.
it was fun. It was a lot of fun, but I also was, what kind of put me out of business there basically was the fact that everybody was getting sit stand desks. I started
Oh.
recommending them to a few people and they're like, I want that. And boom, next thing you know, the whole office had it. And I was out of a really nice paying job, like side gig. So,
But you helped a lot of people, so it's okay.
Yeah.
yeah,
Yeah.
yeah. So yeah, changing postures is great. That's my biggest thing I would tell people. If you have a desk job, every 15 minutes you should be moving, somehow, maybe stretching or getting up and just turning around, doing something. And then every hour you should get up and walk. You should get up and walk around, let those postural muscles breathe and kind of blow like the blow out the carburetor, so to say, for people who are
Sure.
car people. So
Yeah. Yeah. I tell my patients too that travel to see me, I'm like, every hour on your way home, you need to stop and at least walk around your car, go to the restroom, whatever, because just sitting all that time in the car, and after I've made adjustments and they've been relaxed, they tense up again. So I'm like,
yeah,
you've got
that's
to stop.
awesome advice.
Yeah.
Good advice, yeah.
Yeah, one other thing I didn't mention was I also do a breathing assessment on everybody that comes in for TMJ disorder and see what they're doing. I'm really looking to make sure that they're not what's called apical breathing. So when they take a deep breath, if they don't do this, I don't
Mhm.
want them doing that, because that's all that extra activity in the
Mhm.
neck. Even you might even see them like contract some of their facial muscles when they try to take a deep breath, which
Wow.
we don't want that.
Mhm.
So
Yeah, yeah, all my patients always say, "Does Josh talk to you about belly breathing? How's he telling you to breathe?" And all that. They're like, "Yeah, he does, he does, he does." Because I've had a few patients, you mentioned the ribs. I've had a few patients when their first ribs are out, and I have them,
Right.
go back to see you, or they're like, something's different. And, we had a couple of those patients that had some rib issues.
yeah, actually, Fallon even had some rib issues, and she responded really well,
Mhm.
to rib mobilization, and that's not uncommon. That's again those scalene muscles that we talked about right here.
Mhm.
They get from them really being tense. It starts to pull up on those ribs and causes a lot of pain.
Yeah,
Um,
yeah.
so and then that just can be a downward spiral. So
Yeah,
um,
yeah.
How do you measure, or like what instrumentation do you use when measuring the jaw range of motion? And can you demonstrate for us?
yeah, so I'm really technologically advanced here. I use a paper ruler, like literally right here.
Ooh.
So I'm only trying to get, and Alex has talked to me about, I actually bought the calipers, Alex,
Yeah,
by the way.
good, good.
I just keep forgetting to bring them in.
Yeah,
So what I
yeah.
will do is just assess the jaw motion, just have them open, and I put it right in their with their maxillary midline, and then watch them open, and then that also gives me an idea, because it's a straight line. I can see if there's any deviations that are occurring, and then I also check excursions right and left, and then protrusion. And again, same thing, when they protrude, I'm looking to see if it stays midline.
Oh, right.
I also will assess, like, just to see if they have an open bite, or if you have, where their teeth contact is. And I'll check tooth contact after I've done a treatment too. So if I'm treating their neck, particularly the upper cervical, I'll check tooth contact, ask them where they bite, and then have them, work on their neck for a period of time, and then recheck them and see if we did any changes.
So as a PT, and you're measuring these, and you were saying how you go the opening and the deviation. So does that tell you, like, if they deviate to the right, does that tell you something about which muscle you need to work on?
I mean, it could, right? If we have some, we might want to work on medial lateral pterygoid muscles, which are, or the medial pterygoids underneath our, kind of underneath our jaw here and down into below the tongue. And then maybe we might go up and do a lateral pterygoid release. I mean, I think sometimes that could be disc related or degeneration related too, right? And it might not be able to change. The people who are interesting to me would be like, well, it just started happening, right? If they say this didn't happen before, I just started happening. I'm like, okay, well, you need to go see Alex as soon as possible, because we don't, what's happening there? Is this just the beginning of degeneration, or did they have a disc that, that's subluxed?
Right.
And do you find you need stability with the jaw in order for the muscles to relax in the neck or the back?
Oh yeah, absolutely. If people come in and they can't find their bite, their upper cervical is, it's kind of the same thing. They can't find their upper cervical spine either. So one of the things that I do in my assessment is I look and I see, and we're all doing this now, but when they sit there, are they tipped? Like, is their head tipped? So their orbit's high, is their mouth corner high, right? And then I check, and then I see, can I change that resting posture, and what muscles, in the upper cervical spine do I need to work on to try to get them to train that out? Because if you're sitting here, your occlusion is going to eventually be affected also, because your maxilla, gravity's pulling on your mandible differently. So
So when I had a patient in, Josh, that was just like you said, their mandible was tilted, so then their condyle was pushed up and back. And when I had them stand and checked their hips, the same hip was higher. So I put a tongue depressor on the side that was high, had her bite on it. And she said, and my chiropractor can never get my hips to stay in. So I put the tongue depressor on the one side and had her go out my office, walk down the steps, walk back up the steps, come back in, rechecked her hips, and they were in balance.
yeah.
So I'm like, okay, then this goes to show we got to get inside there, balance things out. And she's like, I can't believe like, it was just like a wah, aha moment. It was kind of funny. And so it's just such a compliment of everything working together. And do you ever find that you need more stability in a bite? Like, I know sometimes when we work together, you fix them, and then I'm like, I want to see you as soon as Josh puts you in line a little better and relaxes some muscles. But do you see it? Because I know I see it.
Oh, yeah, absolutely. Yeah. If their bite improves, almost always neck positioning, if it's someone who we had a difficult time, like, will improve, and even the functional motion, like that C1, C2, which is like where we get 40 degrees of our rotation, only occurs at that one joint.
Yeah.
We'll see changes in that. So it's yeah, they're absolutely interrelated, and we and like and evidence is that's not just us saying it. That's there's a lot of evidence behind that. So
Right. Right.
they've done a lot of studies that have showed that. So it's and it's just going to get better, I think, as you
Yeah.
guys keep advancing the profession. So
Yeah. Yeah. Hey, Priya, have you ever tested a bite after you've taken it?
Like, had someone walk up and down the hall?
No, no, like their range of motion or anything like that.
Like, to see if their
Let
range
me
of
tell
motion
you,
has.
because this is like it looks like you're doing some kind of voodoo or something. So I'll take a K7 bite on a patient, and I'll tense them first, relax them, take a bite, and after we take the bite, I'll stand them up, take everything off, all the electrodes and all that kind of stuff, and I have them stand up, and I'll either have them like put their arms out, and I'll have them without the bite. I just have them rest on their regular teeth, without the bite, and I'll have them rotate. And I'll get somebody in there to mark the spot where they rotate to. Then I have them go back, and then I put the bite in, and I have them rotate again, and they always rotate 5 to 6 inches more.
Wow.
Or I'll
No, I
have them
haven't done
turn
that.
their head and then turn it again. Then I take the bite out and have them do it again, and then it's like they're
The
locked.
range of motion increases.
Right.
Interesting.
Or I've
No.
had them touch their toes, or like I do a bunch of little tricks. Have them touch their toes. I have them, it's just amazing. In fact, I used to make mouth guards for a lot of professional athletes and like collegiate athletes or kids in high school that just their parents had a lot of money and wanted to make expensive mouth guards for them. But when you did a neuromuscular mouth guard, my players would say to me, I cannot play without it. I breathe so much better. I feel like, I can do more reps in my benching just because of that alignment and relaxing these muscles.
Well, it's interesting that you say that because I did see a little girl, only like 9 or 10 years old. She's so cute. Her jaw was locking up, like it would lock closed, and then she'd get it unlocked, lock closed, get it unlocked. And she was having headaches. But mostly she had the headaches after playing or during or and after playing soccer. So I made her the orthotic. She was really great about wearing it, but the headaches continued with the soccer. And I just assumed she was wearing the orthotic while she played soccer because I said, only take it out when you eat.
Right, right.
And then finally, I don't know how it came out, but I found out she wasn't wearing the orthotic when she played soccer. And I was like, why? And she's like, I just thought I was supposed to take it out. I was
Yeah.
like, "Why? I never told you to
Yeah.
do that."
Yeah.
So I said, "You need to start wearing it, like, there's no reason to take it out." Her headaches went away.
Sure. Yeah. That was my daughter with soccer too. Sorry, that was a little tangent, but
No, I love it. I love the
yeah,
tangent.
sorry.
So, as dentists, we know that when a patient has no back teeth or there's, like, missing teeth, that the occlusion, the bite is sort of all over the place. And the condyles, the little bony knob the jawbone ends on, they're usually set more back. The muscles are more constricted, causing pain. Do you look at the teeth, Josh, to see if they need to balance out the bite before you start your PT, or do you start first and then refer them to have their bite checked?
no, so I'd start if I find anything in their cervical spine or in their body alignment that doesn't, that I think I can treat, I would treat it. I'd start treating that
Yeah,
first and then,
Totally.
send them on also for more, you know, dental assessment. But yeah, that's that. But that stability, if they don't have stability, it is going to be tough to, to solve their problem,
To move
otherwise,
forward,
because
right.
yeah, right. So,
yeah. So how can people are always asking us like how do we find a good TMJ doctor or someone that we know does a lot of TMJ because I see patients all over and you see a lot of my patients because I'm like if you come to Pittsburgh then you have to see my PT.
right.
And so you see a lot of my out of town patients, but how can people make sure that they find a good PT for TMJ? Like what questions should they ask when they call the office and things like that?
Yeah, so that's a great question. So the
Yeah.
first thing I would do would be find out if the clinic allows. You need time. Like I have my patients have my undivided attention for an hour every session. That
Hmm.
they need to have. So I would call off and say, hey, does a therapist see me one on one, and am I going to see the same therapist every time? Secondly, would be I would try to get someone who is orthopedic manual therapist. If they
Oh,
aren't, so that'd be like a certified orthopedic manual therapist. You'll see like the letters COMT next to their name, or FAAOMPT. Sorry, it's getting, but
yeah.
that means they're people who specialized in treatment of the neck and of the spine, and they're going to have they're going to definitely have some TMJ training also. It might not be like the same level of what would be ideal, but it's still better than nothing. And
Right.
then if there are actually certifications called a CCTT, which is a craniofacial and cervical therapeutics specialist, and that's somebody who I don't have that, but it's basically you went through so much training, and you would take like a test. So I could probably sit for the exam based on the findings. But if they
Yeah.
have that, they're great. So there are some there are there's not many of those people across the country, interestingly enough. But I think
Yeah.
those would be the most for a physical therapist. I think
Mhm.
NUCAs or upper cervical chiropractors can be good also, because they're
Yeah.
gentle. And you work with them, some NUCA chiropractors, Priya?
I work too with an AO chiropractor. She's in Oakmont, Kathy Roth. So she only does the AO, that the
Oh,
Atlantic
okay.
occipital joint.
Okay.
So I do work with her, but when I like working first with the muscle, so that's why I always send them to you first, and then I work with her, and I get good results. And we have a patient coming up that she's going to put him in line, and we're going to verify it with X-rays. And I'm taking like my K7 and all my computers to her office, and I want to take a bite when she's in line. Then we're going to put the bite in and take another
You're
Take all
X-ray.
that stuff there?
you're a nut.
I can carry it. I got a
That's
Casey.
great.
It can go. So I'm like real excited. So we're doing our little, because I don't want her to get, she slips out real easy, and I don't want her to get in the car, or what if someone hits her or she trips on a curb? She's going to knock it out. So I'm like,
Right.
we're gonna make sure we got it right. So yeah, so that's coming up next month.
Love
And,
that.
and do you work with NUCA chiropractors, Priya?
I have one NUCA guy I work really closely with, and then I have an Atlas orthogonal that I work closely with.
Okay.
And then my brother-in-law, I was trying to convince him to come up here to see my NUCA or Atlas orthogonal, but he lives in SoCal. He actually went and saw a Blair chiropractor, and I mean, his headaches have reduced drastically. So, like, he's definitely a believer now. So, I've just seen it work so well. I don't really work with a lot of PTs because I really haven't I really haven't needed to, because the upper cervical stuff works so well, but I would love to, if there's someone that's open to working with me, like somebody that has that training and has
Mhm.
treated TMD before. It's just hard to find.
Well, I
It is hard to find.
it's very hard to find, but I found with working with Josh, it takes a lot of time out of my schedule so I can do other things instead of sit there and massage and try to do trigger point injections. And I just send him to Josh
Yeah,
because he
yeah.
unwinds them for me, and I can be doing other things or seeing other patients in my office for,
Sure,
not that
sure.
that's not meaningful, but he's got good hands.
Well, I'm always demonstrating on my socials and stuff, uh exercises, mostly muscle releases, really massages. So I love demonstrations. Are there any exercises, Josh, that you think would be safe for someone who's watching to do to kind of hold things at bay until they can get treatment from a TMJ physical therapist or a TMJ dentist? Is there anything you'd recommend?
So the first three that I would normally recommend would be Rakabada's. They call it his big three, and they're gentle and can normally help with, just to kind of relax and put the upper cervical spine in a little better position, but then also relax the jaw. The first one I call the fish exercise, which is it's only 10 millimeters opening. So you're going to like start a cluck, and that pre-cluck position where that tongue goes up into that gentle, mild suction tongue position, you're just going to open and close your mouth just 10 millimeters. So, only like a little pinch, and it looks like a fish. And making sure, and at the same time, making sure you're breathing through your nose, that you're in a good posture. And the other two are, I have people just take their head and put their hands behind the back of their head, pull up very gently, and I'm talking like a pound or two of pressure, and then just pull their head back just very gently. That's it. And hold for 6 seconds. Repeat it 6 times.
Good.
Yeah,
feels good.
that one I do during the day.
I like
after I
that.
get up from my chair, I'm like, that
And
feels
again, the exercise though is like, literally, I tell people you're going to go as gentle as you can, and you're going to go gentler than that. So gentler than the gentlest you can do. And then the last one, and that works on our CO joint. So our, cranial-occipital joint, or I'm sorry, occipital, AO joint. I apologize. I'm just AO joint. And the last one is you're just tipping your head. So now we're working on that C2, 3 joint. And again, very gently. So you just grabbing behind your head, and you just very gently tip. And that's it. And those 3, combined, I think, a lot of people get a lot of relief from it. And again, gentle, gentle, gentle. And any exercises you do should not be making things worse. If it's making things worse, it's maybe not the right exercise for you, or maybe you're doing it incorrectly, which a lot of times we find. Alex and I talked about this. She's like, Josh, what'd you give this person? And I said, it's just, things just get lost in, there's so much information coming on a patient when they first come in, and they're scared because they've been having pain. And it's like, just things get lost. And I have videos that I send people, and you can check out, I think we had a TikTok page, which is kind of funny how Priya and I really very first met was through TikTok, before you guys knew each other. But we just like had a brief interaction on TikTok a while back. But
so what is your TikTok? What is your info? What is your TikTok or your
Instagram? It's just exercise, or what's the name of it? It's just
I want the name, and what do you do on it? I mean, I know everybody does sometimes silly stuff, because I know I do, and sometimes real stuff. But what's the name? Where can people find you?
So it's just my Hubert PT. So HUBERT PT, and it's all just information on different things I tell my patients. Basically, I say I'll literally record like, hey, what I did as far as what recommendations for people on posture and on different exercises they can do, on what they're sometimes some about pain science, because a lot of times we have to deal with pain science. People, if you've had pain for more than 6 months, it's not just the jaw joint. It's now we've got some centralized pain that we have to deal with. So it's on all that. It's very, and then I do some other type of physical therapy for the lower, the back and the lower extremities and stuff.
Sure.
So,
what's funny is I was just looking at our messages. I messaged you, and I was like, I love your videos. I did not realize that you worked with Dr. Alex. I just did not connect that till just now.
Oh, come on, Priya. Go with the program.
You didn't connect it. Oh,
but this is 2023.
I thought you connected it.
I don't even remember what I ate for dinner last night, girl. Like, I just can't even believe that I didn't put that together till now. And we were supposed to collaborate.
That was my pillow. Yeah, you commented on my pillow.
Yes.
My one pillow. The wrapping the pillow together.
Yes.
Yeah.
And I think I did like a stitch on that.
Yes, you did. Right. Correct. Yeah.
Oh,
Wow.
it's all coming together now.
Yep.
A little slow on the uptake over here, guys.
That's okay. You
No,
got a lot going on, Priya. We get you. We
no,
get
I
you.
will say, like, we always thought like Priya was like the when we started doing our TikTok page, we were like, Priya is like
The
she is the
queen.
gold standard
Uh-huh.
for like TikTok for
Yeah.
TMJ, and like so that was my front office director and I. We're like, okay, well, if we can reach as many people as Priya does, we're doing pretty good.
You are. And
You're
you've
doing
grown a
So you've
pretty
lot.
done
good.
great. Your TikTok page is awesome. So
Oh,
Yeah.
thanks. It is such a like my guilty pleasure. I love social media. I'm like a social media aholic,
Queen.
which is
You're
so
the
fun.
social media queen. And it's so funny. I love your social media too. I'm like, oh, there's pretty Priya.
Oh, you're so sweet. I think it's so fun. And when I found out what my mentor was doing and how many people he was helping, and he was just one of those guys that would just stay under the radar, keep his head down, do his
Sure.
work, go home. And I was like, we're gonna blast this out of the water. This is amazing what you're doing. I'm gonna make sure everyone knows about it. So that was sort of my goal. But yeah, I think we're supposed to be answering some questions instead of chatting.
Yeah.
So I
Yeah,
oh
guess
yeah,
yeah.
I'm sorry.
Yeah. No worries. No worries. No worries. So
so
Josh, you can help us answer these. So go ahead, Priya.
So, well, he kind of answered it, like,
Oh
if
yes,
yeah,
gave
he
us
kind
some
of answered it, like, if the
exercises.
exercises
Yeah.
make your jaw hurt more, should I stop or should I continue to do them? And I think we all agree, stop.
Yeah.
Yeah.
Stop.
Yeah. Stop and maybe ask somebody, like, especially if they just saw a couple little exercises that you did here. If it doesn't feel good, don't do it.
Yeah.
Right?
Right.
Yeah. So, and I think we did too. Should I see a NUCA PT or chiropractor? All of these are in my community. I think a PT first, just to look at the muscles, as long as they're a PT, like Josh said, they're going to spend time with you and they're not going to say, okay, I see you, Sally, go show me this, and this exercise. Because that's one thing I always tell my patients. If you're going to see Josh, because they're like, I have a PT, I was seeing somebody for my knee or whatever. And I'm like, oh, no, you don't have a PT like this. Like,
Mhm,
trust me. So when they
mhm.
go see Josh, they always come back and they say, Alex, you're right. Because Josh spends the time. That's what
Yeah.
you pay for. That's what you're getting. You're getting his time, his knowledge, and his expertise. So I start there personally. And a lot of times I don't need the others. But it's got to be somebody that knows what they're doing, well trained, and is going to spend the time with you.
Yeah, I think that's
Yeah.
fair.
Well, Josh, thanks so much for being here with us.
Thank you guys. Yeah.
I'm just so thankful, honestly, to have you be part of my practice and help with my patients. And they benefit so greatly from you. So I appreciate it.
No, I'm honored. I mean, I it's been I love what you do with your patients, Alex. And like again, I know I called you a nut, but you just go above and beyond, which I think is awesome. It's like in healthcare the way it is. Um, and I'm really honored to be on this podcast with you guys. I love talking about TMJ disorders and what we can do for people. So thank you very much, Priya and Alex. You guys,
Yeah, thank you. And
You're
so
welcome. You're
thank you.
welcome. Thank you. Chat
yeah,
soon.
thanks so much, Josh.